Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Duplication of ureter. In duplication of ureter, this duplication of the ureter is the most common abnormality of upper urinary tract. Most common type of inheritance of duplication of ureter is by autosomal dominant method of inheritance. It is more commonly seen in females and it is often bilateral. In most of the cases, this duplicated ureter is bilateral. So in the duplication of ureter, there is an abnormality called as yo-yo effect in fused ureter, which is also called as incomplete duplication is also seen. So what is this yo-yo effect? In yo-yo effect, actually, normally if there is duplication of ureter, there is lower pole is supplied by one ureter, whereas the upper pole is supplied by the second ureter. So both these will go and combine and they drain into the urinary bladder. Okay, but then in case of yo-yo ureter, the lower pole is same, but the upper pole and the lower pole of kidneys are upper and lower part of the kidneys are supplied by are drained by two ureters, but in the beginning they are two, but they both will combine together and form one ureter, and only one and both of these will drain into the urinary bladder with one uretary orifice. So this is yo-yo effect or fused ureter, or also called as incomplete duplication of the ureter. Now,
thank you and thank you for watching.